So Trump posted this earlier today. The World Health Organization has become nothing more than a corrupt globalist scam paid for by the United States but owned and controlled by China. When the China virus reached our shores 3 years ago, the World Health Organization disgracefully covered the tracks of the Chinese Communist Party every step of the way. I have tried 5 times, I'm currently trying right now, to upload it's a pamphlet back from the early 2000s regarding an organization I mentioned many times that I happen to be in the profession of. It won't get any views, 0. I've tried since yesterday, deleting it, putting it up again, because it's from their, it talks in there about the International Nurse Council, at the UN, and immigration, and how evidence-based says that for good outcomes, that all people, whether documented or undocumented, should have health care. I mentioned yesterday how, as a nurse, even though the organization I'm speaking of doesn't seem to want to be proactive and say let's stop a lot of things and lobby and support closing the borders. But again, it goes to the globalist agenda. Trump had pulled us out of the World Health Organization, I believe, or I thought he pulled us out of the World Health Organization, and he was talking about pulling out of the UN. But that's what this all goes back to. That's who these organizations here in America follow. And then there's this, and I know there's many people that know about this. I didn't know. I've heard of it. I didn't know about it, what it all entailed. This was 2021, but they've already, in April of this year, they've extended the PrEP Act. This protects everybody from liability. Let me tell you the history of it. And this is what it says. The Public Readiness and Emergency Preparedness Act, PrEP Act, passed by the United States Congress and signed into law by President of the United States George W. Bush in December 2005 as part of, and then it goes into the legal, the codification, all that, is a controversial tort liability shield intended to protect vaccine manufacturers from financial risk in the event of a declared public health emergency. The part of the PrEP Act that actually affords such protection is now codified in 42 U.S. Code 247D60. The Act specifically affords to drug makers immunity from actions related to the manufacture, testing, development, distribution, administration, and use of medical countermeasures against chemical, biological, radiological, and nuclear agents of terrorism, epidemics, and pandemics. The PrEP Act strengthens and consolidates the oversight of litigation against pharmaceutical companies under the purview of the Secretary of Health and Human Services. PrEP Act provides $3.8 billion for pandemic influenza preparedness to protect public health in the case of pandemic disease and outbreak. So this is what they've used, and vaccine manufacturers lobbied for the legislation, which would effectively override state vaccine safety laws in the case of an emergency declaration by HHS, by making clear they would not produce new vaccines unless the legislation was enacted, which we know it was. During and after the aftermath of the 2020-21 COVID-19 pandemic, The PrEP Act is being invoked in a variety of lawsuits, many involving skilled nursing or assisted living facilities, where COVID-19 countermeasures, including the administration or non-administration of vaccines, is said to have resulted in or contributed to resident deaths. Although the PrEP Act was around for more than 15 years prior to COVID-19, the Act's defensive application and litigation was not widespread, but now the application of the Act is being included more frequently in a variety of COVID-19 related lawsuits. Senator Edward Kennedy issued a statement demanding repeal of the PrEP Act legislation while condemning the liability provisions as a giveaway to the drug industry. Kennedy said the bill makes it essentially impossible for injured parties to sue for damages and that the measure allows common diseases to be used as a reason to activate the liability shield. Kennedy also, he's in Congress, obviously. Currently. Kennedy also notes that one of the drug companies that lobbied for PrEP Act is Sanofi Pasteur, which is under the Food and Drug Administration investigation for being connected to at least 5 cases of Guillain-Barré syndrome caused by its meningitis vaccine. When the PrEP Act legislation was presented, its broad liability shields, its potential for undermining state vaccine laws, and its consolidation of responsibility within the executive branch were misrepresented in Congress and media, according to critics, who note that it was portrayed instead as primarily concerned with preparations to combat the avian flu. Yeah, when it was initially, but that's what they're using. They've been using this. Opponents also contended that the PrEP Act would contribute to the potential for abuse of discretion by the George W. Bush administration, which was generally perceived as friendly to the drug industry. In particular, critics were concerned about the possibility that state laws banning thimerosal containing vaccines may be preempted if the HHS secretary designates that a vaccine is covered. Countermeasure thimerosal, a mercury containing preservatives, can be used in a vaccine even in the states that enacted such bans. And this use of the PrEP Act to administer COVID-19 vaccines and ACIP recommended childhood vaccines. PrEP Act authorities empower states and territories to use active or former healthcare professionals and students to administer vital vaccines. So, you can't really talk about this, right, without getting still pulled down to this day. You can't really say everything that, so I have a lot to say about it, especially listening to something an interview I just listened to. Regarding a law, there are some places going after all of this. Many lawyers don't want to they won't take any of this on because they can't get around the PrEP Act, but there's strategic ways they're finding around it, such as, not being given consent, different things like that. But I'm not going to get into, we know what happens when you even talk about this. This is what I'm going to say. I don't think that they realize that it's too late. The healthcare system, the people working in it, may be totally blind to this. In fact, that's what I usually see. They have no idea about any of this. None of it. But most of the Americans do. Most people in the world even. Long ago, 3 years, it's what woke people up. And all I can say is all of these associations and organizations that were involved with this, if they think that continuing to silence people is going to stop this from coming to light, well, think again.